The DA says Ananias Mathe's death has rid society of a dangerous man. Mathe was one of the country's most infamous prisoners. He died in a Durban hospital last night. Let's get a bit more detail on this story now. We're joined on the line by Thulani Mdluli, Regional Coordinator for the Department of Correctional Services in KwaZulu-Natal. Good afternoon to you, Thulani. Can you tell us what the circumstances of Ananias Mathe's death were?
Yes, good afternoon to you and to the listeners at home. We can confirm that the Department of Correctional Services, we have heard the news from the hospital on the 27th that Ananias Mathe has passed on. And we have made some arrangement with the family as we communicated with the family and informed the family about that. At the meantime, we are busy, communicating with the consular of Mozambique in order for the family to be helped further to that.
Well, what is likely to happen, Thulani? Will his body be repatriated to Mozambique, or is he likely to be buried in South Africa?
We at this stage we cannot preempt that because it will be forming part of the family and the arrangement with the consular of Mozambique. But at this point in time, we're just making an arrangement with the office in Durban, the office of Mozambique in Durban to make sure that it communicates with the family. But we cannot, explain further of how is it going to happen at this point in stage.
Thulani, we know that he was suffering from stomach ailments in recent days, but what was the actual cause of death?
Again, it was like that because the medical reports were revealing that it is a digestive system-related illness. But we're also waiting for the post-mortem to detail that because we can't have, all information at this point in stage. But what we have at this moment is that the medical report reveals that it was, a digestive-related illness.
And we know he was imprisoned in Kokstad. Why was he moved to Durban for treatment?
At first, earlier this month, I think it's a month because this thing started a month ago, and he has been transferred by us as Department of Correctional Services with a recommendation from our health practitioners inside our correctional center that he must refer to Edendale Hospital in Pietermaritzburg. And he went for surgery in Pietermaritzburg and then transferred back to the correctional center. And then apparently, it complicated. That is how it forced, situation forced him to be transferred again to King Edward in Durban. So it was the same occurrence, it was the same illness, the treatment was the same, but it was complicated at that time.
He was a man with quite a reputation, having escaped from CMAX, having made an attempted escape on other occasions, one escape where he was recaptured earlier after escaping police cells. I mean, how does Correctional Services feel about the death of a man who clearly put them under pressure?
No, we as the Department of Correctional Services, our mandate is to rehabilitate, to correct the wrong behaviors of the inmates or of the inmates. So for us, we will keep the mandate of the department going to make sure that people who are coming in our facilities, they get what they are expected to get. And we are paying same, respect to everybody, and we are giving the same services to everybody, and to keep our mandate going, because our mandate as the Department of Correctional Services is to correct. So for us, it doesn't, elevate us or give us any pride of any some sort, because to us are the same. To us, we are keeping the mandate of the department going forward.
And would you say that Ananias Mathe, under your correctional supervision, was able to be rehabilitated?
At Ebongweni, these people are kept in a maximum prison, in a maximum system. So it is not the same as other correctional centers whereby they are giving full rehabilitation programs. there in Kokstad is not the same as other correctional centers in the country. So that is why most of those people who are kept there are the most notorious people that we want to make sure that, the public is safe. So that is how it is operating. We can't say because they have got only 1 hour for programs. So it can't be a full, rehabilitation program in order to make sure, because those people who are kept there, they've got a lot of counts. They have got a lot of years to serve in those facilities. So for us as the department is to make sure that the country is safe and we keep the environment safe for those people. But it can't be the same as other correctional centers.